Good evening, everybody. Welcome to our presentation tonight. And I'm very pleased to be joined with Dr. Nico Trocmé, who I will introduce shortly. I'm Kathy LeGros, and I'm the chair of the Jimmy Pratt Foundation. And I'm not only welcoming the folks that are here in the auditorium, but I'm also welcoming people out there in TV land somewhere, so for now and even into the future. I'd just like to give you a few words about our foundation and why we exist. We started in 2010 and developed a focus on resiliency. This was where we thought we could make a difference in the lives of children and families. And we wanted to find ways that we could identify and promote and protect resiliency in families where it exists. We are especially focused on the welfare of children, all children, especially those that are vulnerable and their families. We all know that children exist in families, so you can't have one without the other. We started with a focus on the early years and then moved to early learning and eventually did some research which led, I think we had a very strong role in developing full-day kindergarten here in Newfoundland and Labrador. We'd like to think that we were instrumental. I can't say for sure, but I know that the research and the discussions that we had really had an impact on the decisions that government made. The direction that we're going now, after we saw some success in the work that we did then, is to look more at the issue of children in care. And we realized when we made that decision that the most important thing that we needed to do was to establish a trust relationship with the department. As you know, all of the issues around and the sensitivity around children in care and the importance of protecting them and not causing them any more exposure than they already have. Okay, sorry. So we went with that in mind. We approached the department. We met with the then Deputy Minister of the department, Rochelle Cochran, and told her of our interest in starting research, a multidisciplinary longitudinal study on children in care, recognizing that we could only do that with the approval and the support of the department. Since that time, there have been a number of changes to deputy ministers, which has really necessitated the whole process of developing that relationship again, that trust relationship that is so important. I'm pleased to say that the Deputy Minister of Children, Seniors, and Social Development is here with us this evening, along with other members of her staff. And I think that that's evidence of a new and growing relationship with the department. So when we made this decision, after meeting with Rochelle, who happens to be with us here tonight as well, we decided we would pull together all of the people that we could identify that were involved in the lives of children, that would serve children. Vulnerable children in particular. And that's a lot of people. It's justice, it's agencies, it's social services, it's education, it's police, it's the Indigenous communities, many, many different organizations. I think when we got them all in the room at the same time, there was probably over 100 people there. The first thing that people realized at that time was that it was the first time that all those people have been in the same room at the same time. And recognizing that we all have the same focus in mind, that we're all there to support these children and to help to support them on their way into adulthood and hopefully successful living. It's unfortunate, I speak as a social worker by profession, it's unfortunate that this is the first time that we had a chance to sort of have a direct contact with each other on these very sensitive issues involving these children. At any rate, our one-day session opened with a presentation by the Deputy Minister outlining the key statistics that at that time included outcome data in particular, and it noted the increase in numbers of children in care, even though our population is declining, that educational outcomes were below other students, and that there was a shortage of foster homes, and many, many other things that came out in that research. All these things we know. And from those findings, the plan was to inform policy and the legislative review that was coming up, and to have an increased focus on outcomes. So I'm just going to give you a few examples of some of the comments that came out of that. It was a managed session, and so the deputy minister spoke in the morning, then we broke into small groups, and there was a discussion on various questions. Then in the afternoon, Dr. Michael Unger spoke to us, and with a particular focus on resiliency, and was relating it to our purpose as a foundation, but also to what might be useful in terms of future research and outcomes. Some of the comments that were made in those discussions was the importance of early intervention changes and more focus on family outcomes. Find a way to break down departmental barriers and work more collaboratively. We recognize that this is very difficult with children in care and with that department because of the sensitivity around the issues of all of that. Focus on the family. I don't think there's no need to doubt that there is a huge focus on the family within that department. And to work more collaboratively with families and in communities. I remember, it's an age-old saying, and I remember Rochelle saying it at the time, it takes a village to raise a child. And our goal in all of this as we go forward is to hopefully build a sense of community responsibility to support these children into adulthood. How we do that and where we go with that, I don't know. I guess that's to be discovered. So I started 3 years ago that day, recognizing that there was a lot of sensitivity around all of the information that was coming out and that would come out. And I said then, and I say this now, this is not about shame and blame. We all know that this is a very difficult population to work with for a whole bunch of reasons and complicated issues. And what we want to do is to move forward in a positive way, to find ways that we can support and assist this department in, wait, now I've got another note over here. I'm a little disorganized, I apologize. With a purpose of seeking solutions, of understanding where the gaps are, because I think we discovered that day 3 years ago, and supporting the department through research and facilitation to find informed interventions to effectively support these children and their families. And so we look to our community partners to help us with that in whatever way we find as we go forward that we can engage our community partners. I think there's a desire on behalf of the department to engage the community partners. How we do that and how that's structured is yet to be determined. Dr. Trocmé is here with us now, and we were having lunch today and just having a kind of a casual discussion over what some of those gaps were and how we could do it. And it was evidence just in those discussions of the opportunities that exist if we could just figure out a way to get there. Okay, I want to introduce Dr. Trocmé. My daughter sent me his CV on my cell phone. So I'm going to read this to you now as I received it. So Dr. Trocmé, please bear with me as I say all these, and I know you told me last night not to say too much, so I promise I won't say very much. Dr. Trocmé is the Director of School of Social Work and the Philip Fisher Chair, and the Philip Fisher Chair of Social Work at McGill University. Dr. Trocmé is the Principal Investigator for the Canadian Incident Study of Reported Child Abuse and Neglect for many years, the lead researcher for a federal, provincial, territorial initiative to develop a common set of national outcome measures in child welfare. He directs the Canadian Child Welfare Research Portal and is conducting a research capacity development and knowledge mobilization initiative involving child welfare and Aboriginal service provider agencies in Quebec. Recognized as one of the most prolific social work researchers in Canada, Dr. Trocmé is the author of over 130 scientific publications, has been awarded $25 million in funding through grants, contracts, and gifts, and has mentored a new generation of Canadian child welfare scholars. Dr. Trocmé has acted as a child welfare policy and program consultant to several provincial governments and Aboriginal organizations, and has presented expert evidence at various inquests and tribunals. Prior to completing his PhD, Dr. Trocmé worked for 5 years as a child welfare and children's mental health social worker. So this man comes with a very deep background, and we certainly discovered it in just his level of knowledge and compassion in our discussions with him over the last day and a half. And I know that this is a wonderful opportunity for us to hear this man. He's going to say things, even though I don't know what he's going to say, but he's going to say things that are going to surprise you, and certainly surprised me last night. He asked me questions that I couldn't give him an answer to, not that I know everything, but anyway, it was pretty special. So we really are looking forward to you, sir. There will be an opportunity for question and answers following Dr. Trocmé's presentation, so we'll stand by for that afterwards. Thank you very much.
Thank you very much, Kathy. Well, we have an opportunity to spend some time together. It's a small group, big room, so we'll try to make this work as well as possible. What I'm going to do is look at some of the data that we've been collecting over the last 20 years with respect to primarily the profiles of children and families coming into contact with child welfare systems, as well as some information on children in out-of-home care, to really look at what I see to be one of the major obstacles to collaboration between child protection systems, child welfare systems, and community agencies, community organizations, which is, I think, a misunderstanding with respect to what the needs of these children and families are, a bit of a mismatch between the mandates and the tools that are available and the needs of these families. So if you bear with me, I'm going to spend a fair amount of time going through many different, hopefully not too difficult to follow data slides to make some of the key points I'd like to make, because I do think that understanding the numbers actually makes a difference with respect to how we end up responding to the needs of these children and families. And then I'll speak for a few minutes about some issues specific to this level of collaboration that is clearly needed for us to really organize services appropriately. And then I'm hoping we can use the size of the group to then have a bit more of a discussion with respect to how we start breaking down some of those barriers and really finding a more effective way of meeting the needs of these children and families. So that's the plan. And I'll get started right away with the findings from one of the main studies we've been doing, which is a national study where we go directly to child protection workers across Canada, where we track on roughly a 5-year basis. We get a profile from a representative random sample of children and families. We get a sense of the profile of children and families coming into contact with the child welfare system. We're right now in the second phase of collecting data for the 2018-19 study, so I'm going to be limited to the data we've already collected and analyzed up to 2008. I'll be going back and forth between data both from the Canadian incident study as well as data from Ontario, where we've been able to collect data over a longer period of time, so I can give a little more of a sense of trends. The profile for Ontario is generally quite similar to the rest of Canada, rates generally being a little higher, so I'll touch on that. But this really is the starting point, which is this fairly dramatic increase that we saw in the late 90s to the early 2000s in the number of investigations of child abuse and neglect across Canada, where they went from 135,000 to over 235,000, a rate of 21.4 per thousand children in 1998 to 38 per thousand. That's 2% of children in 98 to close to 4% of children in 2003, 2008 being investigated every year because of suspected child abuse and neglect. This is a lot of children. This is an incredible opportunity in many respects. We have a child welfare system or child welfare systems across Canada that are very effectively identifying the most high-risk group of children in the country. What we do with them, however, is, I think, one of the challenges that we need to think about a bit more. Just to put this in broader perspective, and it's very difficult to compare rates across countries. Some countries are counting children, others families, others reports. To the extent that we're able to compare something close to apples, the rate of investigations in Canada, again for those 3 blue bars that are presented earlier, 98, 03, 08, is what we have there. In kind of purplish, in the middle, we have rates of investigations in the United States, which have remained fairly steady. One of the interesting things, actually 93, when we did the first study in Ontario, the rate of investigation in the United States was double the rate in Canada. We're now in a situation where the rate of investigation in Canada is significantly higher than the United States. The rate of investigations in England has seen a similar increase to what we've been seeing in Canada, but with a delayed effect. And we're just starting to get information out of Australia, where they also are seeing a rise in the number of investigations. And the rise in Australia looks a lot like what we've seen as the rise in Canada. I'll be getting to that in a few minutes, but one of the main drivers in the increase in cases of child abuse and neglect or investigated child abuse and neglect in Canada are situations involving domestic violence. This is still the same slide as the first one, but we've got Canada in dark blue at the front and Ontario in lighter blue in the back. So similar increase, rates of investigations in Ontario being higher than the rest of Canada. But other than that, when we break it down by form of maltreatment, the characteristics are fairly similar. So I'm just presenting this because we'll be going back and forth between the two. Separate to that, we've also been collecting as much as possible data on the number of children in foster care. Frustratingly, this is actually a very difficult number to get. There really are no estimates for the number of children in out-of-home care in Canada. Each province has a number, but those numbers are not. The counts of what gets counted as being in care and out-of-home care vary quite a bit, whether or not you count kinship care. Some provinces don't have data on number of First Nations children in care, only on non-First Nations children. So trying to add it up is difficult. We're in the middle of updating this to bring us into the next 10 years. But the main thing here is that we see a very similar increase to what we saw with investigations, with this increase in the late 90s and early 2000s in the number not only of investigations, but children out of home care, and roughly between 70 and 75,000 children now in Canada in out of home care on any one day. And if you think about the kind of the volume over the year, about half of those children are children in long-term care, and the other half are children who are coming in and out of care. It's about 140,000 children per year who experience some time in out-of-home care. In 2011, we got for the first time information out of the census. So one of the questions in the census was changed. So when the census goes to a household and asks the person in the household who's responding to the census to identify who's in the household, there's a list of questions about their relationship with who is in the household. And they added the category foster child. No one knows exactly how that's defined. So in a traditional foster home, that's clear. How people, for instance, a grandmother looking after her child, but paid through the child welfare system, the extent to which that grandmother will tick foster child or grandchild is not clear. But everything else being equal, given some of those limits to definitions, keeping in mind this does not include children in group homes, in group care. This is by far the most extensive statistics we have with respect to the number of children in out-of-home, in foster care, the number of foster children on census day. And these are rates per thousand. You can see a dramatic variation across jurisdiction in the rate per thousand of children in out-of-home care. And as you're sitting here looking at this slide, my bet is people are starting to figure out that the rate seems to vary, in particular with respect to prairie provinces where there is a much larger Indigenous population. And certainly there's been a lot of focus on the overrepresentation of First Nations and generally Indigenous children in out-of-home care, which seems to drive this. So what we've done is we've separated out, so with the census you can do this, you can then analyze the data in a range of different ways. So we've separated out the First Nations and the non-First Nations children in care. This is a bit of a busy slide, but I'm going to draw your attention first to the lower, darker orange-red numbers. Those are the number of non-Aboriginal children in foster care by province. And what's interesting, if we just go back here, we have Newfoundland at 5.6, considerably below the national average if you aggregate both First Nations and non-First Nations children. However, if you just look at non-First Nations children, what's interesting here is that Newfoundland actually has the highest rate per thousand of children in foster care who are non-First Nations. We essentially have two groups of provinces, provinces like New Brunswick, Ontario, Saskatchewan, Alberta, to a certain extent BC, hovering between the two, that are somewhere around 2 to 3 children in foster care per 1,000 children. And then you have provinces like Newfoundland, Nova Scotia, Quebec, and Manitoba, where the rate is almost twice as high. So something to try to understand and tease apart with respect to what are the factors driving the larger number of children in out-of-home care in some provinces compared to others. Notwithstanding that difference, certainly the most important and dramatic issue here is the incredible overrepresentation of First Nations children in out-of-home care, which ranges from 5 to 10 to, in some provinces, more than 20 times higher. And it's interesting when we look at our data to look at what happens at the front end in terms of investigations. First Nations are overrepresented by a rate of about 4. So there's about 4 times as many First Nations investigations compared to non-First Nations. By the time you get to placement out of home care, that multiplies up to about 10 times higher. A lot of explanations for that. I'm not going to be spending much time on the question of First Nations overrepresentation this evening, but certainly one of the key drivers here is a funding mechanism that the federal government had in place whereby they only funded placement services. So there were no funds available for serving children in their own home, for supporting families. So when the only tool you have is removal, that's pretty much what you do. There are other factors at play. It's not just that, but that certainly is the most important explanation for this difference. Certainly some of the risk factors associated with living in extreme poverty, isolation, housing problems, substance abuse are also drivers that I've clearly shown as explaining some of that difference. But first and foremost, this represents a policy and funding difference more than anything else. And we'll come back to that because the flip side of the kind of negative story here is that policy and funding and programs can make a difference one way or the other. So if you design them properly, you can affect these trends in interesting ways. This is only data I have for Newfoundland, so my objective here was not to look at the situation in Newfoundland more specifically, but I nevertheless wanted to kind of situate the larger study within the context of data that the ministry made available just with respect to basic trends. The light blue bars are the number of children in out-of-home care, and that corresponds to the scale on the right-hand side, and you can see this gradual increase in the number of children out of home care on any one day. That includes children, again, in long-term care as well as children coming in and out of care. The green bar at the top is the child population divided by 10, just so that the scales would work out. And the interesting thing here in particular is while you have a decreasing child population, you have this gradual increase in the number of children out of home care. In red, and the scale on the left-hand side, we have the number of referrals and the number of investigations. So there's a screening mechanism whereby not all referrals lead to an investigation, but the two follow in fairly parallel fashion. And we see that those numbers have gone through a cycle of increasing, decreasing, increasing again. The extent to which that represents shifts in policy, shifts in legislation, or changes in the relationship with community service providers. So most referrals come from schools, the police, community agencies. So how those agencies, how those organizations interpret what it is that child welfare is interested in ends up having an enormous impact on the number of investigations. So I'm going to look at, in a little more detail now, trying to unpack that increase in the number of investigations. I'm going to be looking at data from Ontario. We're just going to look at what's happened to specific types of maltreatment. So again, this is using the Ontario incident study data and in parallel to the Canadian incident study data. The number of physical abuse investigations, and again, these are rates per 1,000. Number of physical abuse investigations from 93 to 2008 went through a period of increase through to 2003 and a bit of a leveling off and decrease. The number of investigations involving neglect also went through an even stronger increase and a leveling off with a slight decrease in 2008. The number of investigations involving sexual abuse actually has been decreasing. The line is increasing, but this is a stacked bar. You have to look at the band itself. The number of emotional maltreatment investigations, again, went through an expansion, and the sheer number actually has decreased. Exposure to domestic violence went through a very significant expansion from 98 to 2003, and has continued to be an important driver. And then we have the newest category, which we weren't tracking earlier, which are the situations involving risk of maltreatment. And this is a little complicated because we have legislation. It's the same structure in the legislation in every jurisdiction. The legislation requires an investigation in a situation where there is suspected child abuse and neglect, and where a child has either been harmed or is at risk of harm. But what's been happening increasingly is we now have investigations of situations where no one is alleging anything happened. So no one is saying, we think this child was left on their own, we have concerns about the child, we think this child has been physically abused, we have concerns about the child. More and more investigations now involve situations where the person calling the agency is saying, we're worried that in the long term, given the lifestyle of this family, given the characteristics of the family, we're worried in the long term there's a possibility that this child might be physically abused. And so where it gets complicated is we're now dealing with situations where someone is saying there's a risk that a child will be physically abused, and that there is a risk that that will then lead to harm. So it's a risk of risk situation, really reflecting this expansion in mandates, and I would say an increasingly risk-averse service population. So agencies, community organizations, not knowing how best to serve some of these families, turning to child welfare to manage situations where there aren't even specific allegations of abuse and neglect, but there's a concern of future abuse and neglect. The end story, in many respects, is if we look at 93, we had close to 40% of investigations involving physical abuse, neglect at 28%, sexual abuse at 24%. By the time we get to 2008, sexual abuse investigations represent only 4% of what child welfare does. Yes?
Can I ask you a question about that? I was actually here this afternoon and I noticed that. And I know there seem to be, I'm a pediatrician who does child maltreatment.
Mm-hmm.
So I see the kids who have been harmed. And there was a bit of a shift in legislation and in how third-party sexual abuse cases were looked at.
Yes.
So that, and I can't swear to the fact they were more involved because I only got it at a certain point, but people have told me that historically, child protection services were more involved with third-party sexual assaults, and now it's only in family. So I wondered if that 24% down to 4 could possibly reflect if across the country, child protection services aren't getting involved if it's not a family sexual assault.
That's right. That is the case, although we've also been tracking police data on sexual abuse investigations, and they're declining as well. I'd mentioned this afternoon, earlier this afternoon, there is real debate around the decline in reports of child sexual abuse, both with the police and child welfare. One possibility, which is, I think right now where the majority opinion rests, is that this represents a real decline in the population, and there are very positive indicators that rates of sexual abuse have declined in the population. A second explanation is that families are increasingly reluctant to come forward with sexual abuse cases, partially because of a fear of loss of control over the investigatory process. And there really is no final answer to that question. I think the second interpretation must bring us to pause somewhat, because we do have to ask ourselves, are we continuing to pay enough attention to something that we were paying a lot of attention to in the 80s and 90s and is less and less on our radars. The other thing is anytime you do a study of young people in out-of-home care, especially young people in group care, they report rates of child sexual abuse of anywhere between 60 or 70 to 80%. So clearly a lot of the children coming into the child welfare system, more than half, will experience child sexual abuse, and yet we're detecting it in a very small proportion of that population. So I think there continues to be questions to ask about whether we're paying enough attention to that particular problem. But notwithstanding that, this transformation where physical abuse and neglect, which together represented the vast majority of investigations, are now heading to a minority, and we've had this expansion in particular with risk of maltreatment and exposure to domestic violence cases. So a real shift in what we're investigating, and then that begs the question of, have we adjusted our services to this new population? Are we really paying attention to this expansion, and are the tools that were developed in the 80s and the 90s the most appropriate tools given this expansion in this population? One of the things we look at also is whether or not there was physical harm noted during the investigation. So again, we're gathering the information from investigating social workers, and we ask them, was there any bruise, any mark on the child that was noted during the investigation? In 92% of investigations, of substantiated investigations, so we already pulled out the non-substantiated ones. So when maltreatment is confirmed, substantiated, 92% of those situations, there is no mark on the child. In another 5% of situations, there is some type of mark on the child, but not one that requires any kind of medical assessment. So a bruise, a scrape on the lower body, but nothing requiring a medical examination. And in 3% of cases, there's an injury that's serious enough to require some type of medical treatment. We then go in to describe specifically what those situations are. This is out of the 230,000 investigations per year. So to put that in context, so 230,000 children investigated per year. There were an estimated 4,700. These are estimates based on a large sample of over 10,000 investigations, but they're still their estimates. So somewhere around 4,500 to 5,000 situations where there were bruises, cuts, or scrapes. Another close to 2,000 situations involving a health condition. These were primarily situations of neglect where there would be an untreated health condition related to living conditions. 325 cases where there was a noted head trauma, 175 cases where there were broken bones, 172 cases where there were burns and scalds. All terrible situations, but you have to put them in the context of 235,000 investigations. So when we think about the population we're serving, it's a population where certainly the primary concern is not physical safety. That's not the driving consideration. We also look at whether or not the social workers report any evidence of emotional harm. That's a softer measure, the extent to which the social workers are really able to determine that. What we can say is that in 71% of cases, the social worker isn't aware of any particular shift in the child's behavior, in the child's friendships, sleeping patterns, and so on. So there's no evidence that they're aware of with respect to emotional harm. 12% of situations they're aware of some kind of harm, not sufficiently serious to require intervention, and 17% of cases they're referring the child for some type of treatment. Now, as I say, this is a harder one to attribute, trying to determine what is the cause of that harm. We also know that a lot of children who are victims of abuse and neglect tend to be somewhat asymptomatic at the time, as essentially a way of coping with a difficult situation. So we have to be careful interpreting that slide, but certainly with respect to physical harm, we're very confident. Cycle after cycle of the study, we end up with very similar results. Again, just to put this into perspective, one of the other things we look at is the child homicide rates as reported by the Homicide Survey by Statistics Canada. And here specifically we're looking at filicides, so children killed by a parent. The rate of child filicides has not been increasing. In fact, any which way we can look at it, we would say it looks like it's decreasing, going from a rate of 43 filicides per million children per year in the 80s to 90s to 32 per million per year. These are absolutely the most horrific situations that we're all deeply concerned about. These are the tragedies that often come to surface when we look at child welfare services, but they are extremely rare occurrences. They're occurrences that if you look at filicide rates internationally and look at trends internationally, they look a lot like this. It's a fairly flat line. There's no correlation between rates of child homicides and the typical socioeconomic indicators that you usually see associated with crime rates or other social problems. It really appears to be an extremely rare and statistically almost impossible phenomenon to predict. Also, when you think about this from an intervention perspective, there is no evidence in the since the 70s when we were tracking these rates and we did comparisons internationally, there's no evidence that changes in child welfare policy lead to an increase or a decrease in child filicides. In fact, our ability to increase or decrease child homicides is, from an empirical perspective, has never been determined. This is really something that, if we're designing a child welfare system with this purpose in mind, we have to admit this is something that we just cannot stop. They're rare events, incredibly unusual. The patterns are very different one from the other, and there really is no science that would help us to think that increasing reports and increasing investigations would lead to a decrease in child homicide rates. So we have to, again, think about that, because we need to be thinking about what is it that we're trying to achieve through the child welfare system. I want to go back to that initial slide again where we looked at the increase in reports and investigations. Here we look at what proportion of investigations end up actually being open for ongoing services. And one of the things that's clear here is while the number of reports has been going up, the actual number of families receiving services hasn't changed that much. So we have more and more activity occurring at the investigation level, but not necessarily an increase in services to families. So we now have just over a quarter of families across Canada receiving ongoing services following a report, which again raises some interesting questions. Altogether, thinking about the increase in children in out-of-home care, the overrepresentation of First Nations children, the expanding mandates with respect to what we investigate, the relatively small proportion of children or the shrinking proportion of children receiving ongoing services within a context where child homicides are not increasing. This then kind of begs the larger question, which is, should we be rethinking the way we organize child welfare services? Do we have the right tools in place? And this is where we've been doing some additional analysis. But before I go into that, I want to speak for a few minutes to the potential impact that policy and funding changes can have on child welfare trends. This is data from Ontario dating back to 1971, where in dark blue we've been looking at the number of children in care at year end. So this is a cross-sectional count. In red, and the scale is on the right-hand side, is the number of families who receive services. So two different scales, two different units of analysis, but it helps us to kind of think about children in care versus families and children receiving services. And there are a number of very notable trends here that are, some of them, quite astonishing. The first is the dramatic decline from the 70s to the mid-80s in the number of children in out-of-home care. So in Ontario, and as far as I can tell, it's very difficult to get data going this far back in many jurisdictions, but whenever I've been able to get any kind of data going this far back in other jurisdictions, the trend seems to be similar, which is that we saw this dramatic decrease from the 60s and 70s with respect to number of children in out-of-home care to the early 80s. So in Ontario, the number of children in out-of-home care dropped from 18,000 to around 10,000 and then stayed stable at 10,000 for a 10-year period. The interesting thing in particular is while you had that decrease in number of children in care, you in parallel had this dramatic increase in number of families investigated by child welfare and receiving child welfare services, which is puzzling in many respects, but this represents a dramatic shift in policies and legislation and service models and funding models where provinces, Ontario in particular, invested heavily in providing services to children in their own home. So simply by developing a service delivery system for children in their own home, putting an enormous emphasis on permanency planning, asking the question, if you have a child in care, what's the plan? Are you moving that child into returning back home? Are you providing services to make that happen? Is that child going to be adopted into another family? What are you doing to prevent that child from drifting into long-term care without a plan? So simply by focusing on permanency planning, family preservation services, family support services, we had this dramatic decrease in number of children in care, paralleled with a dramatic increase in number of families receiving services. Late 1990s, the Ontario coroner decided to hold inquests on 10 deaths of children. The number of deaths hadn't increased. It was the same number of deaths year after year, rare events, but the coroner decided to hold inquests on a series of 10 deaths. These were highly mediatized. There was a lot of focus on why these children had died in the hands of their parents. A lot of concern that the child welfare system had become too family-focused, that children were being left in homes where they were at risk. And then we see the introduction of risk assessment tools and a dramatic increase in the number of children in care. By the way, the child homicide rate in Ontario didn't decrease after this increase in children in care. So it actually didn't have the desired effect. But what we have is a return back to 18 and even more than 18,000 children in out-of-home care. And now we're starting to see a decline in Ontario number of children out of home care. So what is important with this particular graph is that it confirms that changes in policy, changes in programs, changing in funding can lead to important changes with respect to children in care and number of families served. So we know we can affect changes at that level. I want to show you a second example coming out of Alberta. This is the number of non-Aboriginal children in out-of-home care. In the mid-1990s, the government of Alberta started seeing a fairly significant increase in the number of children in out-of-home care, going from 2,000 to 4,000 over essentially a 5-6 year period. Alarm bells went off, and the Alberta government introduced a new series of services and policies under the, what they called at the time, the Alberta response model, which primarily was a differential response model. I'll be speaking a little bit more about that, but the idea was to say, at the front end, when families come into contact with the child welfare system, let's have two different tracks. One for situations where we're really investigating abuse and neglect, and one for situations where families are needing support. So the introduction of that new model and a few other changes, some changes to legislation, increases in services to children and families, had a very rapid effect on the number of children out of home care. And I don't have the up-to-date data on this slide, but I've just got it a few days ago from Alberta. So in 2017, the number of non-Aboriginal children in out-of-home care had dropped back to 2,000. So they were really able to affect a significant shift in that trend. What's interesting is in red, here we have the number of Aboriginal children in out-of-home care in Alberta. Very different trajectory, similar increase through the 90s. The main difference here, well, two main differences. Half of the First Nations children in Alberta are served on reserve by on-reserve agencies funded through the federal government, again, through the same funding model that doesn't fund family support services. They only fund removal. So that would be one driver. So although Alberta was changing their service delivery model. That was not a change that was implemented in the on-reserve agencies because they were federally funded agencies. The second factor was for the urban Aboriginal population, which you would at least think was affected by these changes, none of the service at the time were really developed with those populations in mind. So there weren't First Nation specific urban Aboriginal services delivered or developed. So while we see very clearly that it's possible again to change the trajectory with targeted services and targeted policies for the non-Aboriginal population, because those services weren't developed and targeted for Aboriginal children, we have a very different trend line. So another reminder that we can change these trend lines if we put the right services in place. So one of the things we then went to do was to go back to the Canadian incidence data and ask ourselves, can we rethink the types of investigations occurring, and can we recategorize these cases by focusing on three things? One is the severity of injury, the second is the form of maltreatment, and the third is the age of the child. And I'll show you in a second what this looks like. So what we did is we recategorized the cases. This is again that 235,000 investigations, and we said, okay, so how many of those investigations involve situations where there is severe harm? 2%. Then we looked at situations there was physical abuse, whether there was harm or not. But if there was physical abuse involving a child under 4, even if there was no mark, the argument essentially was a child under 4 who's being hit by a parent is extremely vulnerable. Those clearly are urgent situations, situations where the tools of child protection are absolutely essential from an investigation perspective. Any situation involving sexual abuse, likewise, we argued, these are situations where the urgency of the child protection system, the ability to respond quickly, to investigate within 24 hours is absolutely essential. Likewise, with the neglect, we argued that any situation involving neglect, even if there was no visible harm to the child, but if it was a child under the age of 4, their vulnerability, the fact that these children are not being followed by a teacher at school, that they may be invisible to other service providers for days or weeks on end, given their physical vulnerability, their cognitive and social vulnerability, we decided that children under 4 who were victims of neglect, we should also think of as being urgent situations. I mean, we're stretching the concept of urgency pretty far. For the other 85% of children, we were really finding it difficult to understand exactly how we could think about these situations as really being urgent. There's no particular reason to think that investigating with the kind of powers we have, investigating in the timelines we investigate, that kind of very forensic approach to trying to figure out who did it, what happened, is this an accidental injury, is it an intentional injury? We really couldn't see that as a driving consideration. This is using the 2008 data, using the same distinction between the urgent versus the other, we can call them chronic situations. We see that the increase that we noted from 98 to 2008 is primarily an increase in these other cases, these chronic cases. We see that there was no change from 98 to 2008 in the urgent cases. So, the increase in child welfare investigations from 98 to 2008 certainly didn't reflect an increase in children facing the most urgent situations. It was something else that was driving that increase. Going back to the Ontario data, the difference between the urgent and the chronic cases even more dramatic, and go back to 93, where it was almost a 50-50 split with respect to the number of urgent, these are rates per 1,000, urgent versus chronic cases. And by 2013, the vast majority of investigations in Ontario involve this other category. We actually have a decrease in the number of cases that were categorized, as urgent. So the question is, how do we think about this other 85%? Do we think about these as situations of risk of harm or risk of maltreatment. So are these kind of neglect, emotional maltreatment cases ones where if we don't intervene, it'll escalate and eventually become a physically abusive situation? There actually is no evidence that that's the case. This is not the case that this is a kind of a disease that gets worse over time. The parallel we tend to think of, and potentially a very misleading one, because some of the original cases that led to the development of child protection systems was the very tragic situations of multiple child battery, called the battered child syndrome, where over time the attacks on children increase. And there was a sense of, well, if you don't intervene early, it's just going to get worse. That's not the case for these types of situations. These are not situations that can escalate from neglect into physical abuse. These are situations that will continue as chronic, low-grade neglect. So the issue is not one of risk of harm. The issue is one of endangered development and well-being. And this is where the language starts becoming quite important. And you don't want to minimize the importance of that second category. There's hundreds of studies, at least 200 that we've reviewed, comparing children who've been abused and neglected, in particular children who've been neglected, to any other child, controlling for family structure, controlling for income, controlling for any other factor that might explain things. Children who've been neglected appear delayed on any measure you can think of at any age. Number of words. You look at 4-year-olds who are categorized neglected, they know half as many words as children living in similar conditions of poverty. You look at aggressiveness in the play yard, you look at aggressiveness at school, these children appear more aggressive, increased anxiety, depression, disorganized attachment. This actually is a whole new attachment category that wasn't initially developed when attachment researchers were looking at parent-child interactions. It's only when they started looking at abused and neglected children that they discovered this fourth category of children who go from being clingy to pushing their parent away in this very disorganized attachment way. And disorganized attachment is one of the most significant predictors of very serious emotional, psychological problems in adolescence and adulthood. You look at high school dropout rates, any measure at any age, comparing these children to any other children, neglected children, emotionally maltreated children have worse outcomes than anyone else. So no one is arguing that there aren't very serious concerns here. The point simply is the concern one around safety or something else, well-being and development? You look at the parents, similar thing. Across studies, comparing these parents to any other sets of parents, they're parents who are much more likely to be facing mental health problems, substance abuse and problems, violence within the family, isolation, and most importantly, poverty. In fact, it's that toxic combination of a family facing the types of challenges that any family can normally face. But you face those challenges in a context of poverty, in a context of lack of supports. And those challenges, which are not easy for anyone, but most families are able to overcome. But if you don't have access to those resources, you then have that toxic combination which gets labeled neglect or labeled abuse or labeled emotional maltreatment. But really what we're dealing with, these are probably more helpful ways to think about it. These are situations where a parent is facing a substance abuse problem, doesn't have in-laws, doesn't have brothers and sisters, doesn't have their kids in a school where they're able to protect the children, absorb the family crisis through some type of other response. These are families where children don't have access to nannies, to private school, to summer camps, all the kind of protective things that can help a child navigate the types of crises that any family can face. But those crises in a context of poverty are devastating for these kids. So I know I'm kind of hammering away at this, but I'm trying to make sure we fully understand that the issue of well-being and development is no less serious than the issue of physical safety. But we have language that tends to put one above the other, when in fact all the empirical evidence indicates that in the long term, it's children exposed to neglect who will have the worst outcomes of any form of maltreatment, even compared to physical abuse and sexual abuse. This is the most devastating form of maltreatment for children. And what's interesting is if you actually look at the legislation in most provinces, the terms safety and well-being are presented as equally important. Newfoundland, in your current legislation, states that the priority, the reason for the legislation is to promote the safety and well-being. It doesn't say promote safety and if you have enough resources afterwards, well-being. It says safety and well-being. And the same thing in every single province. In British Columbia, it's the safety and well-being of children are the paramount considerations. Every jurisdiction identifies well-being as being just as important as safety. And yet we have this tendency of thinking about this hierarchy. Well, the first and most important thing is to ensure safety, and then if you have the resources, worry about well-being. So in thinking about the difference between the two as we look at investigations, what we're increasingly seeing is that it's important to really make a distinction between those types of investigations where a forensic lens is appropriate. A child shows up with a broken bone. There are two possibilities. That child fell off a teeter-totter, fell off climbing a tree and broke their bone, doing a developmentally appropriate, healthy activity, which led to an accident, which was unfortunate, but the effect on that child is going to be minimal, it's fixable, you are in, you're out, there's no need to be involved as a child welfare system. That's an inflicted injury, it's a completely different story. The exact same break as an inflicted injury, as an intentional injury from a parent, is incredibly traumatic and incredibly dangerous. So that forensic focus on what is it? Is it an accidental injury? Is it an inflicted injury? Are these drawings from a child just normal developmental sexual exploration or evidence of sexual abuse? You can't mess around with the amount of time you have to investigate. That forensic model, the powers given to child protection services to respond to those cases are absolutely essential. And in fact, we worry increasingly that that focus on, that very forensic focus may actually be at risk in a situation where you're investigating so many cases where that's not the case, where sexual abuse, for instance, represents only 2 to 3% of investigations. Are you potentially losing the skill set, the ability, the experience to do these very complex investigations? Are they being drowned out in this much larger number of investigations where that forensic issue isn't central? On the other hand, for families who are essentially facing a series of chronic problems, the forensic lens is incredibly inappropriate. And your entry point, instead of being an entry point of saying, we've received a referral from your family physician, from the school, they're asking us if we can come and do an assessment to see if there's ways we can help you. Instead of that being your entry point is, we've received a report that you might be neglecting your child and we have to investigate. There's an incredible difference. You're trying to reach out to a family that's already struggling in many ways. If your opening gambit is a report and an investigation, your ability to work with that family is going to be compromised if your opening point is an assessment. You take your time, there's no rush, you set an appointment, you're not trying to catch them in the act, you're not trying to catch them with a disorganized house, you're just trying to figure out how you can develop supports and services around them. It's a completely different service delivery model. So this again is what we need to be asking ourselves. Have we developed the service delivery model that's appropriate to these situations? two things that we've also become aware of as we look at investigations across Canada is that not only this distinction between forensic and supportive or assessment type, forensic investigations and supportive assessments, is that the emphasis seems to be increasingly on investigation and managing placements. There actually are very few services being provided to treating children who are victims of maltreatment. So the one exception for that is child sexual abuse, where we have very well-developed evidence-based services that are targeting children who are victims of sexual abuse. But there actually are very few services for children who are victims of neglect, victims of physical abuse. And you have to ask yourself, we have this large service delivery system, over 200,000 children who are being identified by it across Canada, and yet services specifically focusing on those kids are rare. Services to families, parenting services, but we actually know that children who've been neglected and who've been living in a chaotic environment or an unpredictable environment are going to struggle at school. They're going to struggle with some of the most basic issues around even tracking what a teacher is saying, because they've spent so much energy in just trying to understand what their parent is saying and the relationship with their parent that suddenly being put in a situation where they're having to track a relationship between an adult and 25 other children, they're panicking. They don't know how to manage that relationship. They don't know how to manage that information. They're at a disadvantage. There are ways in which you can help these children learn what they didn't get a chance to learn at home. So there are services that could be developed. It's just concerning that we've put so little emphasis in treating the effects of neglect and abuse. So we have to watch that one. The other piece is, again, services to prevent the recurrence of maltreatment are quite limited. So most of the services that are developed either focus on the investigation, the monitoring of cases, or managing children in and out of home care, but actual services to prevent recurrence of maltreatment are underdeveloped. What we're seeing increasingly, what a number of provinces, and Newfoundland is one of them that has been working with trying to develop kind of a range of different delivery models, is to really move to this differential response approach where you're thinking differently about how to engage with these families. With the high-risk families and the introduction in this province of structured decision-making models are designed to really focus the attention on those high-risk families, to really focus the investigatory and the forensic approach on those families in an appropriate fashion, and to really rethink the way we engage with families that are at lower risk. And again, I don't really like using that concept of lower risk. I remind you that these are families where without support, these children are going to have absolutely devastating outcomes. But there is no particular reason why you have to have those services in place within a week, within a month. It's really more a matter of saying, once you've identified these children and families, you need to make sure that over the next few years, the right set of services are in place. But not with that sense of urgency, but in a planned, thoughtful, supportive way where you can engage the resources around that family. One of the concerns with these differential response models is, well, if you're shifting these families to an alternate response as opposed to an investigative response route, is there a chance that you're going to be shifting the wrong children into that category? Is there a chance that you're going to be missing some of the situations where the safety of the child is at risk? There's been a lot of evaluations done of differential response models. It's not like a program that you can evaluate in the narrowest way. These are kind of systems level models. One of the things that has been looked at is the rate of re-reports or recidivism. And in the most recent study, but these findings are consistent with previous ones, the most recent study that was done in the United States where they compared counties across 6 states with respect to the extent to which they were using alternate response models. They found that there was a 3% reduction in re-reporting rates for every increase of 1% in the use of alternative response. In other words, no evidence of additional risk, in fact, of lower risk as a result of being shifted into the alternate response category. If you're going to move into that kind of alternative response model, into a differential response model, then clearly you need to find ways to collaborate more effectively with community service providers. So this is right back to kind of where we started. And the question is, well, what are some of the barriers to collaboration? And certainly one of the ones that, from the child welfare perspective, is experienced increasingly is a sense that the reporting, or hopefully we can shift to the terms referral, but the referral of cases to child welfare is often responded to by the referrer as kind of a disengagement. It's no longer our problem, we've passed it on to child welfare. And that is an unfortunate starting point because that doesn't encourage and support that kind of continuum of services, but there's kind of a dumping of these hard to work with families onto the child welfare system. So that continued engagement from service providers, from public health nurses, from the school system, that continued support for those children is absolutely essential. The idea that a report or a referral is an opportunity to dump the case is something that really has to shift. On the flip side, from the perspective of community service providers, there's also a sense that child welfare professionals can get quite rigid around their sense of this is our expertise. It's up to us to determine whether there is risk to a child. That's what we do. You manage the other aspects. So there's almost a sense that there's this barrier that arises with respect to whether or not someone who's not working within the child welfare system actually has the capacity to assess risk. Well, we really need to think more broadly what it is we're assessing. We're not just assessing risk, we're assessing family strengths, we're assessing child development, we're assessing a broad range of things that both community professionals and child welfare workers can be looking at. The inconsistency and incompatibility of objectives of different systems arises constantly as a barrier to collaboration. The area where this is most evident is the continued conflict between the child welfare system and the domestic violence support system. There's a real sense on the part of people working in the domestic violence sector that child welfare legislation is blaming victims of violence for their victimization. So the victims of intimate partner violence are somehow being held responsible for failing to protect their own children from that. You actually have a number of studies where women who've been victimized by their partners will report that their partner, after abusing them, will tell them, if you tell the police about what happened, I'm going to call the Children's Aid. So the child welfare is actually being used as a threat against some of these women. A lot of myths and misunderstanding about the missions of child welfare. Domestic violence workers are often under the impression that removal of children is a frequent response to intimate partner violence. We've looked at the data very carefully in the Canadian Incident Study. In 98% of investigations involving domestic violence, children are kept at home. Removal of children in situations of domestic violence is extremely rare. So there's real mismatch in perceptions with respect to what is actually happening in practice and kind of the confusion at the level of community service providers about what child welfare actually does. There's no point in shifting into a more collaborative model if there aren't resources. It just ends up feeling like you're essentially dumping services, children and families out of the child welfare system onto community service providers with no resources. So those resources are absolutely essential. You can't shift to a differential response model if the resources aren't in place to ensure that you have the development of alternate response services. And we really have to look more seriously at reporting and information sharing procedures. In Newfoundland, I don't think it's gotten quite as rigid as what we have in Quebec. But in Quebec, if you're a family physician or a school social worker or a school teacher and you make a referral to child welfare about a child, the child welfare system is not allowed to get back to you with any information. It's a one-way street. It's against the law for the child welfare agency to phone back and say, this is what we did. This was the outcome of the investigation. these are the services we're providing. They cannot share that information. How can you have collaboration when it's a one-way direction of sharing of information? It's impossible. So you really have to be looking at, have you set up reporting laws and investigation procedures that are making collaboration impossible? The opportunities for collaboration start first and foremost with looking for local initiatives, organizations that have already developed strong and effective collaborative relationships with child welfare services. We absolutely have to be developing much more coherent multi-sectoral strategies. Again, I go back to the example of domestic violence. And the contrast for those, and I know a number of you have been in this field as long as I have, the contrast with how child welfare, school, hospitals, mental health services, and the police came up with a very well thought out joint approach to dealing with child sexual abuse. There were clear protocols, the messages were clear about not blaming the child, about supporting the non-offending parent, the messages were clear about keeping the child at home, removing the offender. Everyone knew what the role of the police were. Everyone knew what the role of child welfare was and is. Everyone knew what the roles of the therapists were in working with a child. Everyone thought about making sure that you weren't interviewing a child 23 times around the same issue. Everyone understood the importance of protecting the evidence, but finding ways to support the children. There was a very clear policy framework and programmatic framework in place. Move forward to exposure to domestic violence, it's chaos. No one understands what anyone else is doing. There are contradictory messages constantly. No wonder women who are victims of violence are hesitant to come forward to the child welfare system for help, because they're getting conflicting messages from the abusers, from the domestic violence sector, from the police. It's really not clear what we're doing. So you have to absolutely have a coherent framework to provide services in that context. Much more flexibility in responses. The funding formulas have to be much more flexible. This gets complicated, but you really want the funding to follow the child. I think one of the best examples of that has been the push in First Nations communities for Jordan's Principle, this pushback and saying, let's not get into never-ending arguments about who's paying for what. You provide the services, and if people want to argue about who's going to pay for it, argue about it afterwards, not while a child is sitting in a hospital year after year after year hoping to go home because people can't agree on who should be paying the bill. And finally, and this is going back to the kind of data that we've been looking at, I think there's a real problem with respect to how the general public, as well as policymakers, as well as service providers in the communities, understand what we do in child welfare. And you allow these kind of panics to develop around individual cases in many respects because there simply isn't enough information out there about what we do in child welfare. There's a lot of myth. We've been tracking children out of home care in Quebec for about 15 years now. We're tracking about 150,000 children out of home care, 400,000 children who at one point had received child welfare services. The difference between what people assume is happening and the reality is enormous. Children who, first of all, the vast majority of children never come into care. Those children who come into care, the vast majority of them go back home within about 100 days. Those children who stay in long-term care generally experience very stable placements. There's a subgroup of children who experience incredible instability, but the majority, more than the majority, experience very stable placements. The difference between the reality of the services we provide and what people assume to be the problem out there is enormous. We're failing to communicate an accurate picture of what we provide, and this then leads to this very panicky response to individual cases, shifts in policies, shifts in approaches driven by confusion about what we do. So critically important that we have much more information about the services that we provide and the outcomes associated with those services. So I've given you an overview of many of the statistics that we've been working with to try to understand what those trajectories are, what the profile of these children are. I don't know to what extent this actually corresponds with your experiences. I had a chance to meet with some of the ministry staff earlier today, and certainly had a sense from within the child welfare system that what we were describing, what we're finding, does correspond fairly well with their experience. I'm interested in seeing from the perspective of service providers involved in community agencies, does this echo with respect to what your experiences are with respect to some of the challenges in working with child welfare? So questions, comments, thoughts? Yes?
First of all, thank you for this wonderful presentation. I'm a student in Faculty of Medicine, and my research is around finding ways to improve the intergenerational health of children in the child protection system. So, as you mentioned, one second, the toxic combination of various factors, among the family members, which
This is for our viewing audience.
hello. Yeah. Okay. So my question is about the toxic combination of different things you were talking about. Last Friday, I did a presentation in my faculty, and I showed the same toxic combinations you're talking about in an intergenerational perspective. So how they are transmitted from one generation to another. Yeah. And that was my main aim of that presentation, to not see this problem from at one generation, but looking at in a different intergenerational perspective, where these risk factor transmit from one generation to another, and the same families, their kids, they have these risk factors, and they become the part of the child protective services in future. So that's one thing. So I would like to hear your views on that. Another thing is there was a presentation a few weeks back where one of our professors spoke about this integrated database in New Zealand, where they're able to take, say, one case from Child Protective Services and look at the lifelong outcomes, connecting that data with the Department of Finance, Department of say crime and education, employment, taxation, everything. So what is the possibility of having that kind of integrated system in Canada, and what's the work in that field, if you can just let me know that?
Good. Okay.
Thank
Two
you.
very big questions, but very quickly on the first one, this is the question of that kind of intergenerational cycle. Several things. One is there absolutely is an intergenerational cycle with respect to child abuse. That's well documented, although the majority, and more than the majority, the vast majority of victims of abuse do not enter into that cycle. There's a minority of victims who end up reproducing that cycle. So the first thing that we have to remember is that kids are incredibly resilient, victims are incredibly resilient, with supports and strengths. And actually there's another New Zealand study, a longitudinal study, that followed women victim of abuse, and in particular women victims of sexual abuse, with many of the very devastating long-term impacts. Not only were the vast majority of the women who were victims of abuse managing very well in adulthood, but on top of that, they were able to identify many of the protective factors: community, having someone, a supportive person in your life, having other successes in your life at school, recreation, and so on. So we do know that you can break that cycle, but it's that toxic combination with poverty which really decreases the probability of that cycle being broken. So if we don't do anything about child poverty, the ability, that resilience, is just going to drown in the sheer number of risk factors. So yes, there is a cycle, absolutely. I mean, anyone working in child welfare has experience having the child, and if we stick around long enough, the grandchild of families we've worked with coming back with that sense of multi-generations. But it is possible to break that cycle. On the data question, New Zealand has some very interesting data. Manitoba, British Columbia have done similar interesting things, looking at linking data across systems. It's perfectly doable. It's more than anything else a question of political will. I mean, there are issues with respect to sharing of data, the protection of data, but with modern data analytic procedures, there's nothing that stops us from doing it if we're willing to put that infrastructure in place. That can be particularly helpful. I'm not sure we necessarily need much more research on the long-term effects of maltreatment. There are many studies out there. We know how devastating it is. What we know very little about is the service trajectories of children and families as they move from one type of service provider to another. So to be able to look more closely at how many service providers these families came into contact with, what that contact was like, would be extremely helpful. I'll give you a counterexample, for instance, in Quebec again, where we've been tracking children within the child welfare system. There was a major reform brought in to integrate the child welfare system with the children's mental health system and a whole bunch of other systems. But the data infrastructure to look at that transition from one to the other was never put into place. So while there was an enormous systems change, there actually is no evidence and no way of monitoring whether the systems change actually led to an improvement in access to services. So, you don't want to be involving in a community in large systems changes if you're not going to have the ability to then document the impact of those changes. But it's absolutely possible to do.
Hi, I've really enjoyed your information tonight, so thank you for sharing that with us. I'm an Indigenous social worker here in the city, and I work with Indigenous families, many who are involved in the child protection system. And I understand that you've done research in that area, and I'm just wondering if you could share a little bit about the best practices you've seen, especially with the differential model, of how that works well with organizations and child protection working together for the betterment of the families.
Well, interestingly enough, I think some of the future-looking, anyway, most hopeful models are going to be emerging from Indigenous communities. One of the challenges for a lot of Indigenous communities as they started by, first of all, pushing for equal access to service dollars, now are starting to push for control and management over their own services. Really, the next step is to be able to push for controlling and managing the legislative framework. Their concern is that the laws as they are currently in place set up a child protective system that just ends up reproducing what we've already described here, a system that pushes through a very forensic model every single case of children and families who are looking for support but not necessarily needing support through the protective system. Or through that very specific lens. So as Indigenous communities start looking at developing alternate service models, I think mainstream communities are going to have a lot to learn about a different way of approaching these children and families. Certainly the current model where you report and there's an investigation and you have that frequent disjuncture between the service providers who report and a system that kind of takes over that investigation, that model really doesn't make sense in an Indigenous context, nor does it make sense generally in a rural or remote context where it's literally the same person kind of switching hats as they move from one function to the other. So yes, we have a lot to learn from those models. They're in development, and they certainly have not been evaluated. We're just starting to see shifts in the number of children in care. I certainly know a number of Indigenous communities that are now able to claim that no children are being placed outside of their community, and increasingly some that are finding that they're able to meet the needs of children through extended family care in a much less formal process, but the outcomes of those services are yet to be tracked. But yeah, they're very hopeful models at that level.
Any other questions? Okay, thank you. Thank you, Dr. Trocmé. I just want to say, I'm just going to see if I can get this back in here now.
I tried that already once today. I wasn't able to do it.
I'll
no.
hold on to it. I'll learn from others. Our foundation has engaged in a small piece of research to begin a relationship with the Department of CCSD. And basically, we've done kind of a landscape review or an environmental scan of what's happening in Canada, a little bit about what's happening internationally. And that was hopefully in a way, or is hopefully, to inform government on its new family preservation model, which will be becoming part of the legislation. I'm looking over at our deputy minister here now, looking for affirmation, but I think that is the intent of that review. So from that, because I've read the proceedings report of our meeting 3 years ago, and some of these things have kind of jumped out at me, is that we all need to sit down and have a chat about what we learned in that, what we learned from our researcher, Roger Chafe, is sitting back there, and others, to see where we're going to go in the future with our research. We want our research to be meaningful to all concerned. We want to provide opportunities for research. We as a foundation have come to understand that we need to control, I guess, I don't like that word, but we need to influence or have an understanding of the direction of research. If we've had an experience where people have come in with research proposals that have not really met our needs in terms of what we were looking for. So I know that the department is excited about what's happening in the future. There are a lot of things happening in that department that nobody knows about, and we're just learning about. And we want to find, hopefully with them, and to support them in ways that we can get that information out. I know that Dr. Trocmé this evening talked about the importance of community collaboration, especially in that 85% around that of vulnerable children that need an intervention, that the department, who has the resources to focus on the really highly at-risk families, we can start looking perhaps at our community partners to support us in that regard. We just have to find ways of doing it, ways that everybody is comfortable with. So thank you again, Dr. Trocmé. Thank you, everybody who's here. I was told by my daughter that this video cast will be available on our website. However, our website is undergoing restructuring, so it may not be available for the next few weeks, but updates and more information will be available via Facebook and Twitter. Is that correct? And so stay tuned. If anybody has suggestions for us in terms of directions we can take in research, we would be very interested in hearing that. We're sort of at a staging point now where, sadly, not sadly, I guess, but there's an election coming up, so there's a little bit of uncertainty in the air as to where we're going and what we're doing. But once that's over and that's all said and done, so by the end of next summer, early fall, we'll begin again in terms of the kinds of exercises that we will undertake. I'm just going to look at my wonderful daughter, who's also the executive director of our foundation, to see if you have any. Oh, no. Okay. So thanks again. Have a good evening. Drive safe, and we'll see you again. Thank you.